Hello, I'm Dr. Brent Holzabus, and welcome to our podcast here, Ask the Chiropractor. Ask the Chiropractor is our podcast where if people have a question about chiropractic or chiropractic care, I encourage them to ask a chiropractor, nobody else. You see, if you had a question about your teeth, you would ask your dentist, not your family doctor. If you had a question about your feet, you'd ask your podiatrist, not your dentist. And if you had a question about a medical procedure or something like that, you'd ask your medical doctor and not your dentist. So when you have a question about chiropractic, it's always important to ask the chiropractor. As many people will check with their family doctor before coming to a chiropractor, almost all family doctors have very little education on what chiropractors do. So it's always best to ask the chiropractor. So today I was asked a question I've been asked several times, and I've talked about this one before, but because it gets asked so often, I felt it was time to maybe visit it again. So the question I was asked is, I've been thinking about going to a chiropractor. What should I expect the first time I come? Well, the first time you go to a chiropractor, I'm going to talk mostly about my office because that's the area I'm the expert in, my own office. So what should I expect when I go to the chiropractor? Well, the first thing is, let's say you've had something lingering for a long time, you're not getting results, or you've tried other healthcare providers for relief and you've not gotten it, and you got to the point where you're frustrated and you want to try something new. This is the time normally we see somebody. So the first time you go to the chiropractor, what you'll do is you'll fill out a regular history like you would for any other healthcare provider. Our history is on our website. It's right there. You can go online and look at it and fill it all out. Other chiropractors will have it done differently, but that's how we do it. You fill out your complete medical history. From there, you'll go meet with the chiropractor. Come into the office, make an appointment like you would anywhere else. On your first appointment in my office, we'll obtain the information, we'll go through the history, we'll review anything that needs to be reviewed before we start and discuss anything how we may or may not be able to play a role in that part of your healthcare history. From there, we will do, usually we do an x-ray exam. We do an x-ray exam for several different reasons. The first reason is basically for your safety. We want to make sure that it's safe to take your x-rays. The x-rays will show us that there's any kind of growth abnormalities. Let's say one of your bones doesn't grow right. Let's say one of your bones is congenitally fused. Let's say one of your bones, let's say you have a condition underneath that we don't know about. Conditions like we call ankylosing spondylosis. That's where the vertebrae are growing together. There's no way for us to know it's there unless we take an x-ray. Another condition is called the spondylolisthesis. A spondylolisthesis is when the vertebrae slips forward or anterior. If that's in your spine, we cannot adjust it a certain way. We have to alter the way we take care of you. It's very important that we know it's there. This is why your chiropractor takes x-rays. Primary reason number one, your safety. There is no exam or any way for us to know some of these things exist without taking x-rays first. Second reason we take x-rays, it gives us a huge clue what's going on in your overall health of your spine. Is there arthritis? Is there degeneration? Is there bad disc? Is there good disc? What's the posture like? How much the vertebrae is twisted? How much are they not twisted? Basically, what are we working with? How do I become a better chiropractor? Is by seeing your x-rays. When you ask me that question, how long does it take to get better? It's so much easier for us to be able to answer that when we can see your x-rays. Seeing is knowing, right? So those are the two reasons we take your x-rays. One, is it safe to take care of you? Do I need to alter my way I take care of you? Do I need to change my technique in order because your spine is different and unique? And also, what's the overall health of your spine? What does your spine look like too? What's the technique that works best for the curvature you have going on? I want to do an adjustment. Do I do a clockwise or counterclockwise torque? What's the best way for me to take care of this for your comfort and the speed of recovery and to get the best results possible? X-rays help tremendously with that. So I would never go to a chiropractor who does not x-ray, nor do I take care of patients who I don't x-ray first. Now there are exceptions. There's always exceptions to every rule, but they're basically, most of the people that come in here, they get x-rays. From there, we'll lay you down, we'll do what we call a chiropractic exam. Why a chiropractic exam? Well, we're chiropractors. We wouldn't do a dental exam, we would do a chiropractic exam. What does that look like? Well, we'll probably have you turn your head to the left, to the right. We'll see how your posture when we lay you down versus when you're standing up. We measure your feet to see what's going on with your feet. We might have you turn your head this way, that way, bend your knees, see what goes on with your feet length when we bend your knees versus when you're straight. We might push on your tailbone, have you lift a leg and see what happens. We're doing all these things to see how your spine moves functionally all as a one unit. Because if part of your spine's locked up, we'll get different results on things that we do. Again, this helps us, gives us clues of what's going on. It helps us give us clues of severity of what's going on. To answer that vital question that you all have, how many times do I have to come? These exams give us that information. Now, some chiropractors at this point will tell you to come back the next day. In my office, we go ahead and we proceed and we start chiropractic care that day. For most cases. Again, everything's going to be most cases. Now, how do we know whether we should proceed right away, how we should not proceed right away? It's going to be on what you present. And the chiropractor, too, might need to have more time to analyze and try to come up with a way to take care of you before you start. So some chiropractors take care of you the first day, some chiropractors wait to take care of you the second day. We do it the first day. We just feel like you came in for a reason, that you want relief. So we'll go ahead and give you a chiropractic adjustment that day. Majority of the cases. There's always going to be a few that we're going to want to spend some more time with, get some more information from, this and that. Speaking of more information, if you've been to other healthcare providers before coming to the chiropractor, let's say you've had MRI done, let's say you've had x-rays somewhere else, we want to obtain those stuff too before your first visit. We like to get as much knowledge on you as we possibly can. Again, all this knowledge on you and all this information on you only helps us do a better job taking care of you and answering those questions you have about when am I going to get better? How long does this take? How many times do I have to come? All that information we can gather from other doctors before you come in is great. Now, in Illinois, we are licensed healthcare providers, so we have no problem. You fill out a piece of paper, we send it over, we get those records sent to us. It helps us come up with our what we call a care plan. Because you see, after your first visit, either your second or your third visit, right away with a chiropractor, you should sit down and go over what they call a care plan. A care plan is going to be like, we need to see you this many times. Along the way, we're going to introduce this exercise, this stretch, or have you start doing this activity, or introduce this or that. It's all going to vary on who you are and what you came in with. There's no cookie cutter here. It's going to depend on the individual. But this is what we'd like to see you do. This is how often we like to see you. And we always go over the financial responsibilities too, just so there's no surprises later on, to the best of our knowledge. So we go over all that with you within the first week of starting care. Try that way you understand everything. Now, sometimes do people get better faster? Yeah, absolutely. You're allowed to get better faster. Sometimes does it take longer? Yeah, but we don't encourage that. We try to encourage it to be faster. Now, will we work with other doctors as far as your care plan is concerned? Will we send you to other places and maybe have other people work with you? Absolutely. And if you have other doctors and physicians that you work with, you should let us know, because if we want to send you, let's say, this physical therapy, because maybe you've had lower back issues way too long, and those way too long lower back issues are causing bigger underlying problems, we want to get you with a physical therapist that can complement what we do. And for myself, we use a lot of our friends down the street here to help you exercise better, get better that way. Maybe you have a lack of biomechanics which is causing you problems. So we have coaches that work with you to help you with your running gait and stuff like that, if that's part of the issue. We also work with the health food store down the street with different nutritional things. Maybe you're just really inflamed because you're very toxic. We need to get some supplements going, stuff like that. So we have a lot of different people that we co-care with. We also work with some massage therapists. A lot of times you get so full of so many knots that our adjustments are going to take longer, so we'll incorporate that too. So we work with a lot of other doctors and healthcare providers to complement what we're doing, so we can all work together as a team, gel it all together and make it all work. We have preferred providers we work with because they work with us, basically. And so we come up with a whole team of that if it's needed. Again, that's not always needed, but when it is needed, it's nice to have those connections. That's one of the things that we get by being the team chiropractors for the Rockford Ice Hogs, and we've made all those friendships, those relationships. It makes it really, really easy. So that's kind of what you expect. You come in the first day, we're gonna bring your records with you. If you went to a different healthcare provider before, bring those records with you. We'd love to see your previous x-rays and MRIs, and sometimes if your x-rays are good enough and recent enough, we can just use those. We don't have to take new ones. So we just need them, we just need something to look at before we start to make sure you're safe. We don't want to take anybody else's word for it. We want to see them ourselves. And not only that, but medical doctors and chiropractors look at x-rays a lot alike. Like we look to see pathologies and illnesses and stuff like that. But medical doctors do not get trained to analyze x-rays like a chiropractor does. Because we look at chiropractic stuff in x-rays, right? And they're not chiropractors. They don't know what we look at. They don't know how to analyze the things that we see. So we can't just take a report. We actually usually like to see the films. MRIs, we like to see those reports, correlate those with your films, and put it all together. So bring your previous stuff with you. With that, call the chiropractor first. Tell them you've had stuff done somewhere else that you'd like them to obtain for you to have at that first visit. Makes it so much better. So then we'll take new x-rays if needed. We will do our chiropractic exam and we give you care, and then we kind of go over stuff the second or third visit in more detail with the requirements of what we think it's going to take to make you better. And that would include your visits, your things that we're going to do here in the office, whether it's exercise, stretches, and stuff like that. The third thing would be financial responsibilities. And then after that, what we'll do is we'd also talk about any other healthcare providers that we want to work with together to get you the best care you need. So what to expect my first visit, my first starting care, that's kind of the answer right there in a nutshell. Again, it's going to be different. You might be somebody different. We might have to do something different for you. But that's the majority of people who come here. That's what they go through. So I hope that answers the question what to expect when I first start care. I hope you understand what our goals are and why we do the things we do. And if you don't, always stop and ask the chiropractor. They're always happy to tell you why they're doing what they're doing, and the logic and the rationale behind it. If you go to a chiropractor and they don't want to explain things to you, I want to go to a medical doctor that wouldn't answer my questions. I want to go to a dentist that wouldn't answer my questions. I had to move on. Your chiropractor might do things a little different than the way we do it. We've just been doing that way since 1949, and it seems to work pretty good for us as a third generation practice. We're all went to that school right there, Palmer College of Chiropractic. Palmer Day here, celebrate Palmer. So any questions or concerns, let us know. If you have any more in-depth questions, go ahead and ask below. Maybe next week you'll be Ask the Chiropractor's Question of the Week. Otherwise, go to Rockford, DC, ROCKFORD, DC, RockfordDC.com. Check out our website. Leave a message below there too if you want to get back to us. Stay healthy, stay strong, and we'll talk to you next time. Thanks.